Hello, my name is Dr. James Thomas. I'm a GP and the Medical Director Designate of West Yorkshire Integrated Care System. The ICS, the Integrated Care System, is about how we work together in partnership with health and care and in our communities to really integrate and ensure we deliver joined up care between different health organisations, across health and care organisations. How often have I heard the story from a patient on how many times they've had to tell their story to different health and care professionals as they receive their care, or that we haven't really asked them what really matters to them? Well, if we get this right, not only will professionals be able to see and know people's histories, but the patients will really feel their care is joined up, it's personalised, and really focusing on what matters to them in a more holistic and proactive way. The ICS is about ensuring decisions are made as close to the patient as possible, like here in my consultation room, or in their homes, or in hospitals, as this is where the care takes place. We should only really make decisions at a system level where it does not make sense to do locally, to ensure that we are focusing on the patient's needs and they are part of the shared decision making. So we do what really matters for them. Integrating health and care will mean patients will receive the personalised care they need in a seamless manner that really matters to them, to help personalise their care and so they can access and support within their communities. They will benefit from system population health management approaches that really help identify their healthcare needs and ensuring we are delivering in a more proactive, joined up way that is personalised to the patient. Patients will see how health and care is not all about reacting to situations, but a more proactive approach to ensure they get the right care at the right time and what matters to them in a more holistic approach. The ICS is about bringing health and care and the wider aspects together so that we reduce those inequalities, reduce that variation in our care and use our collective resources wisely to secure the wider benefits of investing in health and care for our patients. To develop integrated care, we have been developing opportunities and partnerships to collaborate and really do what is best for our patients and our people together. And this requires building those relationships and trust. So it's really important that we acknowledge that this takes time, and it's about focusing on our values and our behaviours so that that trust is built between colleagues, between organisations and across our sectors of health and care, of our health and care system. No doubt there have been times when it's not gone right, but you really learn from those as well as when you get it right. And we have learned that our ICS can enable that sharing so many can learn from others and you pinch with pride. We've known for many decades the impact on health inequalities, and the COVID-19 pandemic has shone a light on this. I have already seen how working together in an integrated way, we can really impact and start to make a difference on inequalities. We've seen how working in an integrated way in our communities, we've made our services more accessible to certain communities and populations. And it's by working with our communities and with their leaders and in their buildings that we have made our services more accessible and built the trust and the partnerships. The vaccination programme is a fantastic example of us joining up health and care, working with our communities to deliver more accessible care within our communities. Working together across organisations, both in health and in care, with our communities and with our voluntary sector will mean working in different ways. So it is key that we are taking time to build relationships and trust across our system so that we really work in partnership and we collaborate with the patient at the centre of what we do. We have so often worked in silos and in a reactive manner, and yet we are desperate to work together in collaboration and in a more proactive way to really deliver the holistic care that we all want for our patients, and also gives us great job satisfaction.